This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports.
Here is your special host, the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hey everyone, Brandon here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a graduate from the University of Texas at Houston, where he received his Doctorate of Dental Medicine and his Master of Science degrees. He has received his Master's of Education from the University of Florida and has over 30 years of private practice experience in periodontics. He has become a well-respected educator, speaker, and overall influencer in the dental industry. He is currently the Vice President of Dental and Clinical Affairs and Chief Dental Officer of Biolase Incorporated, located here in Irvine, California. Currently residing in Irvine, California, please welcome Dr. Samuel Lau, DDS, MS, MED. How's it going, Dr. Lau?
I'm doing fine. Thank you. Appreciate it.
Yeah, great to have you on the show here. Really appreciate you taking the time out of your busy schedule to meet up with us and do the podcast.
Well, you're very welcome.
Yeah. So out of curiosity, how did you happen to get into dentistry, and what point did you think, I want to become a dentist?
No, it took a very circuitous route. Never thought about being a dentist till I was actually out of college and sort of searching for something to do, and my parents introduced me to a fantastic dentist who had come back from Vietnam, and from there embraced the profession, and then went on to be a periodontist. And I had taught high school biology before dental school, and probably it was only natural that I would have a blend of both practice and being in academics, and then was at the University of Florida College of Dentistry in the periodontics department, and left there as an associate dean, and then began to pursue multiple projects. I still see patients there in Gainesville, but to pursue multiple projects and consulting, putting periodontics into the practice of dentistry, and recently focusing on the introduction of dental lasers into the practice of dentistry.
Wow, that's rather impressive. It seems like you're used to having that busy schedule, so that would kind of play into the amount of lectures that you were doing over the past weekend that you mentioned.
Yes, I stay busy. Also looking, one of my areas is advising companies on the future of the dental profession and where we are, where we're going, and as it moves into a state of flux, especially in the last 5 years, with dentistry, the delivery of dentistry changing to a certain degree as the DSO methodology of practice begins to dominate where we are in the profession.
I hear you. So definitely quite involved in the technologies that are coming out nowadays.
Yes,
like you like to stay at the cutting edge.
There's a couple of areas that dentists must embrace, and one is for sure being able to market their practice, to create the niche. And the second is to adopt technologies, whether they be a digital scanning impression, CBCT for implants, and my area that I'm closest to, and that is the utilization of dental lasers, especially in the area of crown lengthening, aesthetic crown lengthening, utilizing them for minimally invasive periodontal surgeries, and then lastly, using the erbium laser for managing implant diseases, which unfortunately are becoming more and more an issue as more and more implants are being placed.
Yeah, I'm gonna jump back there a little bit because you had mentioned the marketing. Are there any marketing strategies that you can particularly suggest or that you've used and have noticed have been successful?
Well, one is what I lecture about, and that is finding a particular group of patients that need you and can afford you and appreciate you. And of all the generations that are out there, if we move from the elderly all the way down to millennial, centennial, that generation that has by far the most susceptibility and the most success for a present and future dental practice is that segment of the baby boomers. They are the one that own most of the wealth in the United States, and they are the ones that actually have many of the significant dental conditions that we see, which ranges all the way from periodontal disease, in which 2 out of 3 baby boomers have bone loss, to dry mouth, and they are also the ones that are generally getting the implants. And now that we know that a good probably 20% of implants get implantitis and potentially are lost, this is an excellent group for us to focus with. So in marketing, in my mind, it's find that niche of patients who need you, want you, and can also pay for you. And that would absolutely be those individuals born between 1946 and 1966. My other area that I begin to appreciate now more than ever is that dentists always tend to gravitate where there are also dentists, which in my mind, if I was managing any business, why would I do that?
Yeah.
So I think my point is that we always go to those areas where everyone else wants to go, and then we turn around and complain because we don't have enough patients. There are a substantial number of rural areas in the United States that are totally untapped, and if I was a young practitioner, that's the first place that I would be thinking about is going. Plus, that's where they're needed. So rural dentistry, in my mind, is still a wide open area for success. And that's what I would advise any young practitioner who's going to set up a practice, which, as you may know, that is few and far between because primarily of the student loan debt.
Yes.
But dentistry is still an incredibly viable, positive, successful profession. Just don't go to where everyone else wants to go, and I think you will be happy.
Yeah, creating that competition instead of, like you're saying, going out in those rural areas where people need it. I imagine you've come across quite a bit of that, seeing that you've spoken in 49 out of the 50 states.
But and actually, I just went to Idaho, so now I'm at 50-50.
Nice.
But it is, in creating marketing, you don't do what everyone else does. In other words, I'm always intrigued when someone wants to send out postcards with something like free whitening with your next dental visit, which means all I'm going to get is a bunch of millennials who want white teeth, who have no money, who generally are using their parents' credit card to pay for it, when there are so many outstanding procedures that one can do. But you've got to market it. You've got to use the right technology. You've got to have a website that introduces a niche. And for me, if you don't have minimally invasive dentistry on your website, then I believe that you're going to be way behind the curve in moving forward.
Yeah, it's interesting you mentioned the website because I still come across quite a few doctors that don't have them up, and it's kind of strange they don't have a web presence in this day and age. But and then
the other thing that's interesting to me is web presence. I'm on dentist websites every day, and they're almost cookie cutter.
Yeah,
they're almost like here's who I am. Come see me. And actually, your best websites are those which are compelling, which is why you should see me, drawing the patient in. And so I'm always interesting when I don't see any website that really have quality, real-time patient testimonial. You've got to have things that discriminate, that why you're different from anyone else. But I do want to backtrack a moment. Mm-hmm. We still believe that the number one way to get a high-quality patient that you want, that is compliant and has allegiance to you, is by word of mouth. And that is relationship building. Like.
Yeah.
So when you find great baby boomers that demonstrate quality of care, It's what, I'm part of the Pankey Continuing Education Institute, and Dr. Pankey, which is a very viable institute in Key Biscayne, Florida, and Dr. Pankey always says, like likes like. So you find that great patient, guess what? They're going to refer you another great patient.
Yeah.
It's just common sense.
Well, certainly have your patients almost doing the marketing for you by that word of mouth. That's so very true.
So we believe, again, as far as technology goes, if you see advertisements for medical care, everything you see is that which is same-day surgery. You get up the next day, you can do whatever you want. And that's where laser technology comes in, especially related to periodontal procedures. If you look at something called gum surgery,
mm-hmm.
I mean, let's just think about that. Today, you're going to get gum surgery. I can't imagine anyone saying, I can't wait for that. I've been waiting with bated breath to have my gums cut open with a blade and you grind on my jawbone.
Oh, yeah.
Just give it to me.
Imagine you hearing people say that, just they cringe.
And I know. And when you go on Google to see gum surgery, I cringe. So what if you had a procedure that created the same or better result, that didn't require blades, that didn't require stitches, that the next day you got up and you did whatever you want. You went to work, and yet the result was the same or better than traditional gum surgery. And that is what laser periodontal surgery, whatever laser it is, it could be Biolase, where I'm associated with an Intervine, but laser surgery. And then what happens is that then people do what? Then people go and have the procedure. They don't avoid the procedure. And before you know it, they keep their teeth. And now we're about to approach on a couple of excellent studies, one in particular done by a very, very good group of periodontists who do excellent research, that we're finally going to be able to demonstrate that, yes, you do not have to have gum surgery as we know it to save your teeth. And that means then that middle-class America is going to walk in and say, I do want it, and give it to me, and I want to keep my teeth, and I want to have, form, function, be able to look fantastic. Let me give you an example.
Mm-hmm.
If you and I had our gallbladders removed 20 years ago, they cut you from your molar tooth to your toenail. You get your gallbladder out now at 11 o'clock on Friday. You're at home at 5 o'clock with your feet up, probably drinking a Miller Lite, and you recoup. That's where I'm reluctant to call it dentistry. That's where really all healthcare management should be going.
Yeah, the minimal invasive.
And that is where it is going.
Mm-hmm.
And you are seeing the monthly adoption of dental lasers as we know it by the dental profession. The other part that I would mention about lasers is that lasers are very holistic. Lasers are, I'm not talking about a mantra burning incense. They are holistic in the fact they use light. Mm-hmm. So let me give you another example. If you went in to have lens correction because you didn't want to wear eyewear anymore, you would go in to have something called LASIK.
Yep.
LASIK is laser. It's almost like Kleenex, isn't it? If you had to have surgery on your eyeball, and I said, well, you can go to one ophthalmologist and have your eyeball cut with a blade to get to the retina, or you can go to the other ophthalmologist who has a laser, who uses a unassuming, non-ionizing, very safe radiation to the eyeball without cutting your eyeball. Which one would you want?
Yeah, it's a pretty easy choice.
To me, exactly. And the only reason lasers can't get adopted as quick as they should is because we in the oral health profession are very, very slow to change. and we do what we were taught in dental school. So it is time to change. It's time to rethink who we are, because we are oral physicians of the mouth. We do utilize science, and it's time to move on to where our patients don't avoid us. That's where I'm going with this.
Yeah.
I got to, you ever heard this phrase? I got to go to the dentist.
Yep.
I got to go to the dentist. Oh, geez. Oh, I don't know. I got to go. I don't know what else. I got to go. But maybe something will happen to where I don't have to go. Procrastinate.
Yeah, the situation.
And what we want to try to do is what? I love going to the dentist.
Mm-hmm.
It's convenient. They can do it all in one day. They're not going to hurt me. They're going to make me look fantastic.
Yeah, it's kind of interesting too. It makes me think about how I was watching one of your presentations online here, and you had mentioned about how all the doctors, when they came in, all the dentists were kind of fearful of the laser, but after the 2-day courses and everything, they all left, comfortable. And it just something that ran through my mind was almost like that idea of curing ignorance toward it. And once it gets out there more for everybody, and it becomes more common.
Yeah, and I could understand about the comment of ignorance, but we are, again, like. If you didn't experience it in dental school and you really want to do what's right for your patients,
mm-hmm.
actually a level of fear and anxiety comes in with anything new.
True.
Now, in some ways, I like that. I wouldn't want to go to a physician who what we call the innovator or the early adopter that picks up the first thing that comes around. But at the same time, agreeing with your comments, it is time to at least trust that we are moving out of the early adopter innovator stage into the early majority. I am absolutely convinced that laser will be the standard of care in managing gum disease. I'm convinced of it because of the minimally invasive nature of it,
mm-hmm.
Because of the safety of it. But maybe it's because we're not doing a good job of introducing technology as well as we should into our dental schools.
Yeah.
Because you're right.
Mm-hmm.
You're exactly right. They when they go into that a 2-day laser course and they pick up that laser, sometimes they think of it as like Star Wars.
Yeah.
It's like a defense system, like something's going to zap somebody. But you have to convince them that actually laser is much more safe than having a radiograph taken of your mouth because it's non-ionizing radiation.
Mm-hmm.
But once you control it and you appreciate the precision of it and you appreciate the science behind it and the fact that there are significant numbers of studies and even more coming out, that's when the tide will change. And you're also now starting to see your very, very large group practices, aka DSOs,
mm-hmm.
now starting to say, wait a minute, we're competing with each other. We need to start off, if we're going to be a major component of delivery of dental health care in the United States, then we need to get on board. And you are seeing that with some of your prominent DSOs out there like Heartland that are now engaging in laser technology along with other areas. And they're doing an excellent job of educating the practitioner on how to use these technologies. And that's very, very positive for us. I don't really want anyone picking up any new technology unless they've been educated and educated correctly.
Well, certainly.
So, taking an online course to use a laser, in my mind, that would not be for me. But that's just the fact that I've taught high school biology before I went to dental school and blah, blah, blah. So.
Yeah. Now, along those lines, is the Biolase Learning Center, is that actually located in Irvine, California?
Yes. The primary training center for Biolase is in Irvine because Biolase, which has probably the market as far as numbers of lasers sold in the world, is in Biolase, and actually the lasers are made in Biolase. So they make them and they train them at that facility in Irvine. Although Biolase also has other training centers, including Dallas, centrally located, and in New York City.
Oh, that's pretty cool.
And most of the courses for Biolase are 2-day, very intense courses with follow-up, with access to clinicians afterwards to ensure that any questions that you may have, because that may be the first time they've ever touched a laser.
Mm-hmm.
That's not the first time they've touched a high-speed handpiece, but the first time they've touched a laser. So Biolase, like other quality techno companies, education is absolutely critical in this particular business to make this happen.
Well, certainly.
And so as we look at also key opinion leaders that are out there, I mean, in other words, folks that we practitioners look up to as being credible, and when they move forward, whether it be implants or whether they move, I believe, in trays for orthodontics, the same is true for lasers. And folks like Dr. Christensen, Gordon Christensen, has personally told me that, it is time that we need technology to try to manage periodontal disease, besides what we have been doing in the past, so that middle-class America, or really all classes of America, can afford and also feel very receptive and going in for non-threatening procedures. So the point is that we're now getting important key opinion leaders in the world that are beginning to appreciate that laser technology is that which will actually attract more patients, and then we're able to provide more care, and then naturally we have less teeth extracted, less pain, less discomfort, and everyone looking fantastic.
Well, certainly. Yeah, and kind of as you're talking about that, it made me wonder about, I see in my notes here that you're having an event upcoming here pretty soon in Irvine on September 20th and 21st. Can you share with us anything that you're going to be addressing in that?
Sure. Biolase will have a first-time symposium that will be in San Diego in October 18th, 19th. I spoke about Dr. Christensen. Gordon Christensen will be the keynote for that, and we'll be exploring with the practice of dentistry, various technologies that he believes are the present and future of where we should be. But also, the speakers range from not only restorative dentistry, aesthetic dentistry. We'll have Greg Kinzer coming in from the Spear Group. We will have clinicians discussing lasers. But we'll also have a couple of speakers that will be honing in on this whole tongue tie issue, especially with newborns, children. And you may be aware that that is a very interesting topic now, including sleep apnea.
Yeah.
But also for the newborn, using laser technology to actually correct what we call the frenums, to do frenectomies, and thus very much create a scenario of babies with lactation issues and being able to grow to maturity with correct jaw scenarios, decreased sleep apnea, and that whole area will be investigated with this symposium. We'll also have some key opinion leaders in the area of implantitis. Dr. Don Clem, who actually practices in Fullerton, who has published multiple papers on implantitis, will be speaking on the area of lasers and management of implant disease. So there's about 12 speakers, and there also will be a dental hygiene assistant track that is not just about lasers themselves, but how to manage patients that need lasers and to be able to look at from the dental hygiene perspective. And along with that, there will be workshops. There'll actually be a laser certification course for dental hygienists. And then there will be an advanced laser course in aesthetics and in managing implants. So that's coming up. It's almost sold out. We're looking very forward to that. And that will be probably, Biolase will then probably have something similar to that on a annual basis, somewhere probably on the West Coast. This one will be in San Diego, and it'll be October 18th and 19th.
Excellent. Yeah, that sounds like that's going to be a pretty exciting symposium there. Now, obviously, a big fan of lasers. What are your thoughts about CAD/CAM technologies and impression scanners?
I can't imagine folks not using digital impression in the future. I used to walk into a large audience and say, how many of you are using digital radiography? And there would be 3 or 4 hands that would raise. And a couple of years later, there'd be 10 or 15, 20. And a couple of years later, now I walk in. Anyone who doesn't raise their hand is looking down at the floor when it comes to digital radiology. And I would suggest that the exact same thing is going to occur in digital impression and scanning. I am not going to take a stand on milling, but many practitioners will suggest to you that milling belongs in the dental lab. They don't have the chair time to do it right, but they do have the chair time to do an incredibly fantastic prep and to also be able to digitally send that and get a fantastic restoration from that. So I just can't imagine that in the future does not include CAD/CAM and include digital impression. I also can't imagine that dental practices, almost the majority, will not have CBCT. And also to complement where the implant is placed, then use the technology to create the provisional, possibly even using, this is where you might see 3D printing and at least doing the provisional. Mm-hmm. And at least at this point, it's still going to be the dental lab that's going to create the beautiful shape, the color, the contours that's needed, because let's face it, we especially, well, I should say anywhere in the world, aesthetics is incredibly important to all of us.
Most certainly.
So yes, I would agree that I can't imagine dentistry not totally embracing that technology of digital impression. But I will suggest, again, to make another little soundbite about laser. Mm-hmm. The problem about digital impression is what you see is what you get. And you will find that once you do digital impression, because you don't have a tray anymore, and we'll get granular here, that because what you see is what you get, you better either use a laser for troughing or you better use a lot of cord, because you've got to distend that margin or you're not going to be able to find it.
That's
with digital.
Yeah, certainly very true. And always from a lab standpoint, I was excited for the digital impression age, given the fact that we're eliminating these extra steps of expansion, contraction with stone and everything of that sort. Do you have any advice that you would be wanting to give toward new dentists coming into the field that are starting out?
The first thing is, no matter what you hear about maybe doom and gloom, because I do see that sometimes, mm-hmm. It's not. It's an outstanding profession. For me personally, it was something that blended my cerebrum with my dexterity. But more importantly of all, if you don't like people, get out of it. Because to me, that is one of the most positive things about being an oral health practitioner, and that is your relationship with people and a personal relationship with people. Because sometimes we forget, we are working in a very, very, very personal part of their body. Mm-hmm. It is called their mouth. And we continue to think ourselves as only as tooth docs. Our dental schools now, my friends, if you graduated more than 20 years ago, our dental schools are not like that anymore. Our dental schools are creating professionals that are what I consider to be oral physicians. We're creating individuals that know a heck of a lot more about medicine than physicians would ever know about dentistry. Mm-hmm. So for me, I suggest find a fantastic practice. And, you know, in closing on that part, there's one thing also I think that we have somewhat forgotten about, but not for me and my generation, and that is we relied on mentors. Find yourself at least one or two high-quality mentors. And dental school can give you some of the mechanics, but high-quality role model mentors, that's what can accelerate you into being successful in dentistry. So my advice would be, first of all, don't do that unless you have to. I know you have debt. I'll be the first to say you have debt. But don't let debt determine what you do on a day-to-day basis for something that you've spent not just 4 years, but 4 years of college and 12 years before that. Do it right. Find the right mentor, and then like, and you'll become like them.
That's excellent, Dr. Lau. I really appreciate it. And then almost going back and adding into what you had mentioned before, don't go to those areas where everybody wants to be.
You know, you can say it a million times, but you know, we're in a culture to what? We're selfish. We want to spoil ourselves. And then we get there, and then we almost on borderline ethics. We sometimes, to keep the doors on the hinges, sometimes we are challenged to do things that maybe we shouldn't be doing. And I don't want to see our profession go there. Smell the roses. There are wonderful, wonderful people, sorry again, in rural areas. And they love you. I mean, they may pay for you with eggs and whatever, but they will love you, and it's a great place to be is in rural America and in the practice of dentistry.
Excellent, excellent. Well, I certainly do appreciate your time. Is there anything else you wanted to add?
No, your questions were great. I'm proud to be a dentist. I'm hoping that others that are coming out of dental school will feel that level of being proud, that we're not just employees, that we do have a major relationship with patients, and that patients do rely on us for trust and wisdom. And I know that we're going to be able to continue to deliver that. So, no, I appreciate you for having me on the program.
Oh, yeah. I completely appreciate you as well. Thank you so much, Doctor.
Thank you.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.